Hey everybody, I wanted to take a little bit of time and just kind of talk about my experience with endometriosis, what I've been through, and where I am now. Endometriosis is a disease that a lot of women suffer with. You may not be sure what's happening, what's going on, what is going to happen. And I just kind of wanted to answer some of your questions and give you a real woman's perspective on what's going on and what you have to look forward to and what's about to happen. For those of you who do not know what endometriosis is, it's when the endometrial lining of your uterus, the part that breaks down into your menstrual cycle, that tissue comes out of your uterus and starts attaching to your other organs. It can attach to the outside of your uterus, it can attach to your ovaries, your fallopian tubes, your bladder, your intestines, it can attach to your pelvic bone. It can pretty much go anywhere. When this tissue attaches to your organs, it continues to try to break down like your regular menstrual cycle. So it can cause scar tissue on your organs, it can cause minor internal bleeding, and it is very, very painful. Um, some of the most common symptoms of endometriosis include painful cycles, extended cycles, pain during or after intercourse, painful urination and painful bowel movements, diarrhea, constipation, generally when you're on your cycle. Also cause severe anxiety and depression depending on how severe the pain is. If you've ever been in a large amount of pain for an extended period of time, then you know the effect that it can have on you psychologically. When I was 18 years old, I started having severely painful cycles. I would wake up in the middle of the night and I would just be wrapped in pain, all the way from my stomach around to my lower back. It was very difficult to walk. I couldn't function when I was dealing with this pain. At first, it started out that it was just, for 3 or 4 or 5 hours during, when my cycle first started, and then over the years, it just got worse and worse and worse. And that is the way endometriosis works. It is a microscopic disease. It can start out very, very small, and go undetected for a long time, but it can cause you a lot of pain. And the longer you go without it being treated, the worse it gets because it continues to grow. When I first started having this pain, I went to my doctor, my general doctor, and was talking to him about it. And he's the one that brought up endometriosis to me. I had never heard of it. I didn't know what it was. So I did some studying about it and I did some research on it. And it really hit home for me because every symptom that was on the list I had in some type of way. I started seeing an OB and I started going to them and talking to them about it. Around this same time, I was also diagnosed with chronic ovarian cysts and PMDD. PMDD is PMS on steroids. You have the same emotional effects that you have with PMS, but it is exaggerated, 100 times over. Cry and scream and yell for no reason at all. It can cause you to be extremely depressed. Some women even have suicidal thoughts and actions during this time. Clinically insane for 3 to 5 days out of the month. I was going to my OB and he started doing, he did sonograms on my ovaries and that's how he detected the ovarian cyst that was causing some of the pain. And we did MRIs and CAT scans and all types of tests to try and, figure out what was going on. And he determined that more than likely it was endometriosis. The problem with endometriosis is it is a soft tissue, so it cannot be detected on any type of scan, test, anything that you do, unless it is extremely advanced and they can actually feel it when they do your pelvic exam. The only way to diagnose endometriosis is with a laparoscopic surgery. At the time, my doctor didn't feel that that was the best thing to do. A lot of times, minor endometriosis can be controlled with hormone therapy or birth control, basically. So they started me on different types of birth control to help control my pain and my symptoms from, my cycles, but also to control my PMDD symptoms. I was never able to take birth control. None of it ever really worked for me. I had really, really bad side effects to it. Mainly, it made me extremely depressed. So we tried that for a few different years, and then back in 2008, the doctor I was going to decided that it was time to do a laparoscopic surgery to try and confirm the endometriosis. We did the surgery, and I came out, and my doctor told me that he didn't find anything. Everything looked normal, everything looked fine. There was nothing wrong. There was no reason for me to be in this much pain. You know, basically, it was all in my head. And his solution was to put me back on birth control. Depo-Provera was the one birth control that I was able to take without any serious side effects, but what a lot of women don't know when you're on the shot is that it can cause bone loss after, you know, taking it for an extended amount of time. For me, that wasn't a solution to the problem. That was just putting a band-aid over it and ignoring it. I knew that there was something wrong. I knew that there was something going on that was not normal, and I didn't want to just cover it up. I wanted to figure out what was going on and fix the problem. And I was actually able to find a specialist here in my area. He is one of the best in the country, and because I was a new patient of his, he of course wanted to try me on birth control. There, you know, are a lot of new different types of birth controls that can really work really well for women. I agreed to try the low estrogen. That made me severely depressed. He tried me on the NuvaRing. I didn't have any emotional side effects with the NuvaRing, but I had a lot of really uncomfortable physical side effects. There are side effects that I'm not going to go into, but it didn't work well for me. So then he tried me on the low estrogen. That one also made me extremely depressed, and I gained 50 pounds in 2 months taking this pill. Doctors will tell you that the birth control pills don't make you gain weight, but they do. With the extreme weight gain and the depression, I decided to get off of it again. There were 3 or 4 other birth controls that he tried me on, and none of them worked. He said the only other birth control he could try me on was the Implantion. I think that's what it's called. It's the implant that they put into your arm. And I knew that that was not a good option for me. With the side effects that I had had from previous birth controls, I couldn't put myself in a position where I would, you know, be forced to take something that I couldn't easily get off of if I'm having extreme side effects to it. At that point, I felt really kind of hopeless. The pain had gotten worse. My cycles had gotten worse. It had gotten to the point where I was in pain all the time. There was really no relief. You know, it started out for just a few hours when my cycle first started, and then it eventually got to the point where I was in pain every single day. Debilitating pain where I would have to take time off of work, stay in bed, and take pain pills, praying that, you know, it would go away. So I went back in and I started talking to my doctor again about it, and he decided that he wanted to do a laparoscopic surgery again. He was not the doctor that had done my first one, so he decided that he needed to go in and look around. I'll be honest with you, I was not very confident in the surgery. For so long, I had been told that there was nothing wrong with me. Everything's fine. It's really just in my head, just exaggerating it, and you know, there's no reason for me to have this pain. My biggest fear going into the surgery was that I would come out and he would tell me that he didn't find anything again. But I agreed to do it, and he actually was able to find endometriosis. He found a lot of scar tissue from past endometriosis, and he also found something called adhesions. It looks like a spider web. It's a type of scar tissue, and it will go in and bind your organs together that are not supposed to be bound together. I'm going to show you guys some pictures from my surgery that he took. If you're uneasy with this, or if you're kind of squeamish about these types of things, you might want to turn away for a few minutes. This right here is the actual endometriosis that he found. Well, one of the pieces of endometriosis that he found. And as you can see, he's just lasering it off there. This one right here, you can see the adhesions here, these little strings right here. Those are the adhesions that he found, and those were all over. They're down in there too. Let's see, here's another one. You can see them all through here, all these little white string things. Those are the adhesions that are the type of scar tissue that actually were binding my organs together and causing a lot of the pressure and the pain that I was feeling on a daily basis. He also went in right here. You can see these two little dots here. You have two nerves on each side of your uterus that send out pain signals, and he actually went and cartilized those two nerves to kill them so that it doesn't send out pain signals from my uterus anymore. The day of the surgery, when I came out, I immediately felt better. The pressure and the pain that I had been feeling on a daily basis was gone immediately. As far as the surgery goes, I went in about 6 o'clock in the morning. My surgery was scheduled for 7:15 and it started on time at 7:15. They go in, they put you under, they fill your stomach up with gas so that they can move your skin away from your organs and look at everything clearly. You will have anywhere from 2 to 4 incisions, depending on what they find and what they have to do. The first surgery that I had 2 incisions, one on my belly button and then one down right on the top of your pubic hairline. With this one, I have 3 incisions. I have the one in my belly button again and also on my pubic hairline, but I also have another one on my lower left side. They go in, they blow your stomach up with gas. They're going to put a small camera and a light inside of your stomach, and that's the laparoscope. And then they're going to go in with a laser if need to take off, remove whatever they find. That's basically it. And then when they're done with all of that, they try and get as much of the gas out as they possibly can, but they're never going to be able to get it all out. Recovery from this surgery can be very uncomfortable and very painful. The gas can get stuck inside your stomach and it moves around. This time it got up into my shoulders. It's very painful. That was gone the first day, but the gas did get stuck under my ribs this time, and it makes it feel very tight and like it's hard to breathe. That's why you see me now even still kind of labored breathing. I feel like my ribs have been broken or bruised because there's so much pressure underneath there, and you can feel the gas moving around, and especially getting out of bed in the morning is very difficult. Moving around and walking does help. And you will eventually start releasing the gas. You'll start burping it out and it'll start coming out of other places. So there's going to be a lot of very unladylike things going on, but it will go away. The first day you're going to feel great. The second and the third day are the worst. Feel like you're dying. All the pressure from the gas in you, sore from the surgery, tired. I mean, the second and third day, you're pretty much going to be bedridden and you're going to be miserable. You take the pain medicine, keep a steady regimen of it, get some Gas-X. Have somebody in your family, your husband, your brother, your sister, your mom, your dad, whoever, get some Gas-X. That will help break up the gas that is stuck inside of your stomach. After that, I'm telling you, you're going to feel great. I'm on day 4 of recovery from the surgery. I still do have the tightness in my stomach and in my ribs. I'm sore from my incisions still, but I feel better than I have in the last 12 years since I've been going through this. This has been a 12-year battle for me, and I finally have some relief, and I finally have answers to why I've been in this type of pain. My post-op appointment with my doctor in about a week, and he is going to start me on a monthly shot which will go in and kill any endometriosis that he couldn't find, and it will keep it from growing in the future. And along with all the scar tissue and everything that is gone, I should be pretty painless. I shouldn't have very much pain after this, hopefully. We're going to cross our fingers and hope that this is the end of it for me. But I will definitely keep you guys updated, and if you have any questions about anything that, if you're going to have this procedure and you're nervous about it, or if you just have any general questions at all, please feel free to comment, leave your questions below. I'll be happy to answer anything for you. Hope that this helped somebody out there that's going through the same thing, and hopefully you get some relief from this and you get some answers.